Coming up today, a discussion on aging and unlocking agelessness. I'm not even quite sure if agelessness is a word, but it's basically about aging slower, and I think you are going to need it and enjoy it.
Hi, I'm Tony. I'm an author, presenter at Sky Sports, and years ago I went to the jungle and got ill. Very ill. So this is my podcast adventure to find more energy. It's packed with biohacking, science, health tech, supplements, and some of the most well-known experts on the planet.
This is something I spent 4 months of my life doing with electrodes glued to my head so that you can do a lifetime worth of meditation.
Decide what you don't give a fuck about, which is something you don't care about.
Some of it gets quite out there.
I had some stem cells sent up to my house that I had stored, and then I injected myself with mannitol.
And we even hack hangovers.
Alcohol is poisonous. So is water and oxygen in the wrong dosage.
So that's my podcast, Zestology. Live life with energy, vitality, and motivation.
Yeah, so today on the podcast, it's a focus on aging. Welcome back to Zestology. Thanks for listening. I'm Tony. And Nichola Conlon has been a guest on this podcast before. Today, though, we're discussing why you might need NAD+ to stop aging so quickly. Often on this podcast, I feel that the secondary topic, the primary ones are energy, vitality, and motivation, but longevity seems to come up so often. It's an area that people are very interested in. And as we always emphasize, it's not about living to 180, although that is what Dave Asprey told me on this podcast he wants to do. But for most people, it's about living healthier as well as perhaps living longer, but, being in great shape. So less inflammation, being active, and having lots of sort of healthy, fulfilled, productive, purposeful years ahead of you. And Nichola Conlon has been on Zestology before, but she's back to talk about this topic today. We start off by talking about longevity and health. Then her specialist subject, which is, she is a scientist, but she specialises in NAD+. She's got a company around that as well. And her company have done some clinical trial results. The differences between the different ways to boost NAD. You can get injections, you can get NR or NMN. The differences between the type of supplements you might want to take. The differences between biological and chronological age. And all things to do with longevity, really. I met up with Nichola at the Health Optimization Summit in June. There was no time to be recording podcasts then. So we put a date in the diary to chat on Zoom, and this is what happened. And I think you're going to really enjoy it. So, apart from that, all good here. I'm surrounded by boxes. If you listen to my last personal update, you will know why. And if not, you may want to go back and have a listen. I think I might record another personal update maybe next week. But yeah, boxes everywhere. A lot of bags as well. For the details, go back and listen to the personal update. But for now, here is Nichola Conlon on Zestology.
Nichola, was it really 2 years ago that we spoke on this podcast?
It was. I was very shocked by that.
Can't believe that. How are you? Welcome back to Zestology.
Yeah, I'm great. Thanks for inviting me back, Tony. Thank you so much.
Oh, yeah, it's brilliant. I can't believe it's been ages. It felt like it was last year. Why don't we start? Could you remind people, firstly, what it is you do, and tell me about the company as well, and then we can sort of dive into how things are going, and all sorts of other stuff will come from that.
Yeah, absolutely. So I'm a scientist. I specialize in the science of aging, or more specifically, what it is that goes wrong at a cellular level to cause sort of all the signs and symptoms that we experience as part of the aging process. Because despite the fact that we traditionally try and treat aging from the outside, everything to do with aging actually starts deep within ourselves at the cellular level, which many people forget. So, my job has always been, how do we age? Why do we age? And what can we do to slow aging at the cellular level? My background is actually in drug development. So for a good while, my role was developing drugs that were designed to slow aging. Which always seems like a crazy thing when I say it out loud. A lot of people go, "Oh my goodness, is that even a thing?" But we know that aging is our biggest risk factor for pretty much every single disease that we suffer. age-related diseases are have a huge impact on us. And the idea is that if we can slow aging even just a little bit, we can actually have the impact of delaying the onset of age-related diseases. So that's where all that comes about. But I actually left that world for a couple of reasons. One was that there was a lot of really cool science that was going to take an awful long time to be translated into drugs and actually get to people that could benefit from it. And the second thing was that a lot of molecules that we were researching that seemed to work really well were not drugs. They were natural molecules. They were things that are very well known, things that are very safe. But unfortunately, they weren't patentable for drugs companies. So if a drugs company can't patent it, unfortunately for them, it's not commercially viable, and therefore they won't take it into development. So what I saw was a lot of molecules that worked really, really well that were just getting put in the bin and not getting the research that they deserved. So I left that world in 2017. I set up a company called Nuchido Laboratories. And basically what we're all about is how do we take those other molecules and, give them the research and testing that they deserve, and translate some of these really cool scientific breakthroughs into consumer products so that people can have access to them now.
Yeah. And one thing I've enjoyed about getting to know you is that you're sort of an aging longevity go-to expert for me. And there's been a couple of times I've sort of asked you about stuff and you've come up with some excellent recommendations. So I know that you walk the walk in this world. It's not just what you do with your company, but I think I ran a skincare. You recommended some skincare for my wife, didn't you? Which was amazing. I think she might even still use it now.
Yeah, I really follow this space. I, like you say, practice what you preach. I do think cellular health's incredibly important. So yeah, I'm completely engrossed in the world. I follow everything that's happening. Because it's a really exciting space to be involved with, anything to do with aging, because for a long time we thought that aging was this inevitable process that you really couldn't do anything about. You can't reverse the march of time. But now as scientists, we know that actually there are things you can do to not only slow, but even reverse the aging process. So it's incredibly exciting.
Yeah. And just from a looks perspective, I mean, this is going to probably sound a bit cheesy, but I think you look younger than we chatted a couple of years ago. What's going on there?
Well, if I looked old and haggard, it wouldn't be a very good
But if you looked older, that would be perfectly natural since you are older.
Yeah. Yeah. Well, like I say, I practice what I preach. But I think the really interesting thing is that we now know that there are ways that you can measure aging. We've always measured our age in terms of, our chronological age. So how long have we been on the planet, according to our birth certificate? But there's now ways to measure biological age. Yeah. And our biological age is the age at which we are on the inside. So it's, if we look at your cells, it's how well you are really aging at the cellular level. And what we know is that this is a much, much more important way of predicting our future health than our chronological age. Because quite often people's biological age and chronological age don't match up. So if your biological age is older, that's obviously bad because you're aging quicker than you should be. But on the flip side, if you've got a biological age that is younger, then you are aging at a much slower rate than you would be predicted to. So when I tested my biological age, it was a lot younger than my chronological age. So
great. Was that with glycan age?
Yes. So for that test, I use glycan age. There are many different ways to measure it, but I think glycan age is a really cool company with a lot of good science. Have you done glycan age?
I have. I was slightly disappointed in the results. I mean, it didn't come up 10 years older, but I think I came up like 1 or 2 years younger.
Okay. Yeah. So when I did mine, I was...
I don't even want to know. Oh, come on. I'm not happy about this at all.
So I need to repeat it again. That was a couple of years ago now, so I need to repeat it. But yeah, I think it's really interesting that we can now measure things like this, because it allows us to know whether, all the sort of biohacking and all the different interventions that we're doing are actually having an effect at the cellular level, which is where it really counts.
It does. The issue I have with GlycanAge is, and I also think they're a brilliant company. However, with some tests that I take, there's actionable stuff that you can get from the result. With GlycanAge, it's a number, which is nice if it's lower and not so nice if it's older. But from there, you need to know, well, what is actually causing that? And it doesn't dig into that. Then you need to do the other tests. And I mean, I actually did some fascinating mycotoxin tests about 6 months ago, which came up very high levels of mycotoxins, a couple of mycotoxins, which is linked to mold exposure. Yeah. But it's sort of, in some ways, it's quite daunting because it's hard to get rid of mold. But in some ways, it's quite liberating because you sort of think, oh, right, well, that explains a lot, Yeah.
Yeah. I think the exciting thing is that these tests are now all available, and they are really new. And, the science is still developing. Yeah. And I think the more in the near future, we will be able to sort of take a test and be like, okay, this is an actionable step of how you're going to reverse this.
Yeah. Yeah. Yeah, and continuous glucose monitors and stuff like that, that's just the start of what we're going to be able to test on a continual basis. 10 years time, we'll all have a probe in our arm testing our GlycanAge levels on a continual level. It'd be amazing.
Yeah, do you know what? I did a continuous glucose monitor for the first time a couple of weeks back. Yeah. And I now say to everyone, you should do it at least once in your life. Like, just so you can really understand what your body is doing beneath the surface. Like, there's nothing that wants to make you put down a piece of cake more than eating it and watching the level of your sugar just go through the roof and then go straight back down in real time. Yeah. And I think, a lot of people have no idea the battle that is going on inside their body constantly, with sugar and the types of foods that we're eating. So to see in real time that actually your body's having to deal with this all the time really makes you think about what you eat. And for me, the most surprising thing was the drinks that I was having.
Was that?
So drinks were spiking my sugar or my glucose way more than anything I was eating. And when I say drinks, it was coffee with milk. Yeah. So I was shocked that I was having like a coconut milk latte.
Yeah.
Thinking, I'm
you think good. Coconut milk's fairly low carb.
Yeah, no, through the roof, like, crazy. So then I did a bit of an experiment where I did all different types of coffee with all different types of milk. So, I did cow's milk, oat milk, coconut milk. Then I had a black coffee. And the black coffee was obviously fine. It was not the coffee or the caffeine or any effect of that was spiking the glucose. It was the types of milk, and they were all just as bad as each other. The worst was the oat milk, but even cow's milk was really bad for me. So I was like, my goodness, like I am literally starting my day off in the not a good way just by having my coffee. So that's made me change a few things.
The thing that I noticed was the most unexpected for me, and the thing that spiked my blood sugar the most when I wore one was I was working at Sky at the time, and they had a very highly subsidized canteen. I guess the food was fairly cheaply prepared there as well. It was all very delicious, but there would have been a lot of sunflower oils and rapeseed oils and that sort of thing. And I ended up figuring out that it was the cheap food and the sunflower oils and the seed oils that was spiking my blood sugar more than anything else. Wow. Because I was sort of looking at a plate of food and thinking, that's not that high carb, but it was just unbelievable the spike I was getting from it. So it had to be that, which I found fascinating. And then I thought about it. I thought, well, it sort of does make sense since from an ancestral point of view, my body's not probably very used to digesting this sort of food.
Yeah. Yeah. So interesting.
Yeah. Yeah. And then in terms of, I wanted to do a bit of a refresher on NAD plus and NAD in general. And I would love to do a refresher from a personal perspective as well, because I feel like this is a supplement I would love to take more of. And I'd love to take your supplement all the time, and I don't. And that is because I'm quite a sensitive supplement person. And I sort of tend to cycle things and do certain things at once and introduce things very carefully. And when I have taken NAD in the past, I've felt like I was a little bit sensitive to it. So go over why I know why it's so important for longevity, but I want you to remind me, and then we'll talk a little bit more about the specifics of what your company does.
Yeah, absolutely. So NAD is something that has been hovering around the longevity space for a good while now. And, I think even since we last spoke, it's become even more and more popular, especially in the UK. It was something that not many people in the UK knew about. It was mostly the US, but now more and more people are talking about it all the time. And for good reason, because what we know is that the NAD is a natural molecule. It's found in every single cell in our body. And it's important for many, many different things. But the two that it's famous for are energy production. So it helps convert the food that we eat into the energy that all of our cells and our whole body needs to function in our mitochondria, which are our little energy powerhouses in our bodies. And the second thing that it's really important for is for repair. So NAD basically acts as a signal to keep cellular repair switched on. So as a very general rule of thumb, if you have high levels of NAD, you will get lots of energy production and you will get lots of repair in the cells. But if you have low NAD, energy production goes down and also repair goes down. So these are very critical cellular functions that are relying on this NAD molecule. Now, where it's become interesting is it's been found that our NAD actually declines with age. So when we're young, we've got really high levels, but as we get older, it's dropping. And the statistic for this is actually quite scary. It's estimated that we lose 50% of our NAD every 20 years, and this is from birth. So, by the time you're 20, you've lost half of your NAD. Wow. Then by the time you're 40, what you had at 20 is halved again, and then so on and so on. And this means that it's a real exponential decline. So when you look at the cells of elderly people, they don't really have very much NAD left at all, which is very scary considering what I've just told you it does in the body, which are two incredibly important things. So as you get older, NAD declines, you get less energy production. So this is one of the reasons people feel much more tired as they get older. They suffer from brain fog because the brain needs a lot of energy to function. And also one of the reasons why we're less resilient, we take longer to recover from things. We are damaged, our cells are damaged more easily, and we get an accumulation of damage. And this ultimately results in the process that we call aging. So it's very important. And scientists said, well, okay, if we've got this molecule that does all these important things, but it declines with age, then why don't we just not let it decline with age? Or why don't we top it back up to youthful levels? So now there've been hundreds of experiments and tests and studies and published papers that show that what happens is if you top NAD back up or don't let it decline, you get huge benefits to cellular health. And, this covers everything from better energy production by our mitochondria through to, repair of DNA damage, through to autophagy and recycling in our cells. And then when you look at a more, physiological level, this is things like better cognitive function, better muscle mass as we get older, better immune function. Like, it doesn't matter what it is, it seems like NAD plays a role and seems to improve it. And to date, NAD is one of the only things that's been found that actually impacts all the hallmarks of aging. And when I say hallmarks of aging, what these are the 12 key things that have been found to go wrong in our cells to cause the aging process. And NAD seems to improve all of them.
Wow. I mean, it doesn't get much more compelling than that.
Yeah, it's quite amazing. I always say that NAD almost sounds too good to be true because, when you list off the the number of things that it helps with, it's like, yeah, right, it can't really help that many different things. But actually, when you look at the physiology, it makes perfect sense, because NAD is in every single cell. It's involved in, I think, in total over 300 different reactions. And as I've mentioned, some of those are absolutely critical reactions where if we didn't have NAD in our cells, we'd literally be dead, because we couldn't produce energy, we couldn't repair. So actually, it does make sense as to why it has such a big impact on our bodies as it declines, and also why we see a huge benefit when it's restored.
Today's podcast is brought to you by Well Easy, the healthy online store delivering you absolutely loads of savings. You can get brands like Hunter & Gather, Exhale Coffee, Clean Lean Protein, so much good stuff, Biona Organics, and it all comes with massive discounts. We get a Well Easy order about once a week. We absolutely love it. And I know a lot of people have signed up since I've started partnering with them on this podcast. And I'm just really tough to be doing it, really. So you can use the new code, which is Zestology 2023, to get £10 off your first order. If you're the sort of person who shops at Planet Organic or Whole Foods and winces every time you get the bill, and you probably are if you listen to this podcast, you may want to give it a go. And it's always a good day when we get a Well Easy order. So go to welleasy.co.uk, use the code Zestology 2023. If you're in America, and I know about half of my listeners are, then I'm sorry, it's not in the States at the moment. It's like the equivalent of Thrive Market, but maybe soon. Maybe at some point they'll be there. But for the moment, it's the UK only, and it is welleasy.co.uk with the code Zestology 2023. Now, back to the show.
I was just thinking, in terms of your background, I wonder what your ex-colleagues think of you now. You know, I mean, there's been such a debate around, example, COVID, the difference in treatments between the sort of pharmaceutical approach and the natural approach, which wasn't really given any credit. But actually, there's a lot of thinking that, you know, vitamin D, for example, could make quite a big difference to people. And I guess you've followed quite a different path to the one you were on when you started out.
Yeah, you know what, that's such an interesting question. So when I left my job in drug development, the number of people that were like, oh my goodness, what a mistake you're making. Like, you are throwing away a good career. You have this highly credible, you know, professional job. And you're going to start a supplement company. What?
Yeah.
You know, something that has such a bad name, like the supplement industry. And I kept saying to everyone, like, you know, the body has no idea what is a supplement, what is a drug, what is a nutrient. You know, they all have equally powerful physiological effects. Your body doesn't, you know, absorb vitamin D and go, oh, this isn't a drug, so I'm not going to let it have any effect, or it's not going to do anything. You know. And I've seen the power of all molecules, not just drugs. And I've seen how, you know, what goes on in terms of the patentability of things and what gets left behind because of that. So I think I have a very unique perspective in that usually people are in one camp or the other. Usually people are all pharmaceutical, they are all academic, and they, you know, will not entertain the other side. Then you have people from the other side who are very, you know, anti-drug, anti-pharma, you know, natural is the way forward, you know, in that space. And I sort of really, you know, sit in the middle or between the two, where I absolutely value what, you know, some of the pharmaceuticals do. And there are necessary indications and the need for pharmaceutical drugs. But then I also absolutely agree that not everything needs to be a drug, you know, and never mind molecules. A lot of it can be lifestyle, and that people just don't understand enough to implement it. So yeah, I see it from both perspectives, and I think people respect that because they know that I've come from a world of pharmaceuticals, and actually, you know, gone to the dark side that people sometimes call it. But there's, you know, I'm not doing that from an uneducated point of view.
I mean, it is strange, isn't it? It's a strange world we live in, that, you know, supplements are almost, something natural is almost seen as less credible than something, and I'm talking from a very mainstream perspective here, But how could that be less credible when it's totally natural? It's not going to do you any harm for starters. And I guess that's what you come up against with what you do.
And I think one of the main issues is the system is set up to fail. So the problem is that for the supplement industry, for example, if you completely follow all the rules and regulations, a supplement is not allowed to, treat a disease. You're not allowed to claim that it treats a disease. You can't claim that it's going to, have any repair anything or that kind of wording. And even if you do all of the testing on a supplement and prove that it does this, for a lot of countries in terms of advertising, you're still not allowed to say it. So you can have all the evidence you want that proves it works, but you cannot say it because it's not classified as a drug, and only drugs are allowed to have any real impact on disease. So for this reason, this is why a lot of supplement companies simply don't do testing, because what's the point in investing huge amounts of money in clinical trials when they can never talk about the results? So this is why you end up with a very unregulated industry, with a lot of things out there that are claiming things and, don't have the evidence, because the more reputable companies are just like, well, why would we bother?
Okay, so the supplement companies there's no point in testing because they can't really talk about the results anyway.
Yeah, exactly that. They can't, they could do a trial to prove, I don't know, a supplement cures Alzheimer's, for example, just completely hypothetical. And if they found that evidence, they would not be allowed to talk about it. What they would have to do would be to take their supplement off the market, then to go down the whole drug development route and bring it back out as a drug.
That is just, depressing, isn't it?
Which then it wouldn't get the funding to be brought out as a drug because it would probably be an unpatentable molecule because it's probably natural, and therefore drugs companies won't touch it because they can't patent it. And therefore, they're not going to invest the money in because they can't own it.
Yeah.
So it's a complete catch-22.
It is. And on the other side of it, as you say, the supplement world is quite unregulated. And I know from having had my own supplement company for a while, I was surprised at how little we needed to, how few boxes we needed to tick. And actually, we were coming up with labeling, and we didn't really know what we were doing. So we paid a company quite a lot of money to do it for us and check that it was all legally correct. But we could have done it without paying that company. We've just done it ourselves. We virtually could have made up the numbers. I mean, it was amazing how we had no idea what we were doing, and we seemed to be getting away with it.
Yeah. And this is a real problem.
Yeah. So in terms of NAD plus and NAD, I'm really interested in the longevity piece, and I'm interested in reintroducing it. But is it the case that some people are more sensitive than others to? I think with me, what happens is anything that causes any sort of detox reaction, that happens quite quickly because I think there's stuff to detox. We were talking about mycotoxins earlier on, and there's stuff there to detox. Therefore, it works so well that I have to go slowly. Does that make sense?
Yeah, I think it does with some things. I think in the case of NAD, it kind of depends how you're trying to boost your NAD. So when NAD first sort of came about as this thing that was important and it was good to boost it, there were a lot of different methods that suddenly started to spring up of ways that people could boost their NAD. So one of the very early methods where people just said, well, let's just put pure NAD in a capsule and swallow it.
Right.
Now it was established very quickly that wasn't a good idea.
Remind me why it wasn't a good idea again.
Because NAD is a very unstable molecule. It does not survive very well outside of the body, never mind the body, outside of the cells. So it just degrades really quickly. So if somebody had put NAD in a pill, you could bet that by the time that pill, got to your house, it would have no NAD left.
Right.
And it certainly wouldn't survive the gut without being broken down. So the sort of next solution was, okay, well, let's do IV drips, let's put NAD into our veins, essentially, an intravenous drip, because this means we can mix it up fresh, and we can avoid the gut, and we can get it straight into the body without any barriers. So again, this has been done for many years. And the issues with NAD drips are, yes, it does actually get NAD into the blood, but NAD doesn't do very much in the blood. It actually needs to be inside the cells to perform its function. Right. And NAD is a big molecule, which means it can't just, slide through into the cells. It actually needs special little like channels for it to pass through. And to date, we know that the only cells that actually have these special channels are our heart cells and our brain cells. So basically, that's an issue, because it means that a lot of the NAD just stays in the blood and it doesn't actually get into where it needs to be. Okay. So this is why when people have IVs, they sometimes get some bad reactions and don't feel good. People describe it as like heart palpitations and really feeling sick. And this is because the body is like going into overdrive, trying to get rid of all this huge amount of NAD that suddenly landed in the blood and then can't get anywhere. So yeah, not very pleasant, very expensive. Probably has its uses in neurodegenerative disorders, heart failure, things like that, because the NAD can get in. But NAD is important in every cell, so you're missing a lot of your body. Yeah. So the next thing was, well, why don't we, if we can't use whole NAD, why don't we use the raw materials that the body uses to make NAD? So these are called precursors. So anybody that knows anything about NAD will have heard of things like NMN and NR. And these are the raw materials that your body uses to basically make NAD inside the cells. So that was thought of as the next best way to boost NAD. If you take a load of raw material, hopefully it'll go into the cells, and hopefully your cells will turn it into NAD. So there's a lot of hope in there. What we now know is that actually one of the main enzymes that takes these precursors and converts them into NAD declines with age. And this is one of the main reasons why NAD declines. So you can take as much precursor as you want, but if you don't have that enzyme that's going to convert it into NAD, then that's an issue. So it's kind of established within the field now that the sensible way to try and boost NAD is actually to fix the reason why it declines. So to actually switch back on that enzyme that produces NAD in our cells, because actually our cells are very, very good at making their own NAD when we're young. It just gets turned down as we get older. Yeah. So I think we know that some people may have reacted not so well to some of the earlier methods of NAD boosting, simply because it was ignoring the reasons why NAD is declining and, not fixing the root cause. And I think it's important to remember for anything that if something has declined in your body, there's a reason for it. So rather than just topping it back up, have a think about what the root cause is and what is actually causing the issue in the first place.
Yeah. So remind me what the ingredients are of Nuchido.
Yeah, so we have a range of different ingredients. The number one question we get when people look at the tub is, well, it doesn't have NAD in it. Yeah. And hopefully people now realize why it doesn't have NAD in it. They're also usually surprised that it doesn't have NMN or a precursor like that in it. What we use is a precursor called nicotinamide. The reason we use that over NR or NMN is because it's actually freely diffusible. The other ones also require special channels to enter. So we have the building blocks or the raw material in there, but then we also have a huge range of other different ingredients in there which are actually fixing the root causes of NAD decline. So we have things like Sophora japonica in there, which has an active molecule called quercetin. And what quercetin does is it helps to switch back on that enzyme that helps to make NAD within our cells. We have another ingredient, alpha lipoic acid, which is also acting to do this as well and switch the enzyme back on. We have a range of other ingredients in there that are actually inhibiting some of the processes that break down NAD. So what I didn't mention earlier is that as well as our production of NAD going down as we get older, our consumption actually goes up due to inflammation. So chronic low-grade inflammation actually wastes NAD. So our product also acts to try and inhibit some of this inflammation, so it's not wasting our stores of NAD. There's also ingredients in there that deal with methylation issues. So I don't know if you've ever come across people saying, oh, if you're taking an NAD booster, you need to methylate, take methyl donors.
I've not heard of that, no.
Yeah, so a lot of people take things like trimethylglycine alongside like NMN or NR, because what people find is that as they try to boost their NAD with precursors, they suddenly become deficient in methylation groups and methyl donors, which causes a lot of negative side effects, because methyl groups are very important for the rest of our body for things like epigenetics, for example, and detoxing. So the reason this happens is because when if you're not addressing the root causes of NAD decline, so you're not switching back on that NAD production enzyme, what you find is you start to get a buildup of some of the breakdown products of NAD in the cells as it's being used. And the way that the cell deals with this is it methylates and excretes them. Right. So all your methyl groups are getting targeted towards this unnecessary process, and they start to be depleted. So we have some ingredients in there as well, which actually inhibit that process to prevent that issue from happening.
Right. Well, I'm sold. I'm going to get involved again. And my wife loves it. I sort of have dipped in and out, but this has been a very helpful refresher for me. And I also like to introduce new supplements very slowly, one at a time, check they're working, check it's all going okay. Often, I'm such a sensitive supplement man. Like there's some supplements, even now, I take less than 1/10 of the whole pill. I literally empty the rest down the sink and it works perfectly. But then there's one supplement I take called biotoxin binder. And I recently forgot to empty out the 90% down the toilet. And it was like, I really felt it bad.
That's so interesting. And it's probably, something in your genetics. You could probably identify it looking at some of your genetic profile to see what that is.
Yeah, I think there's definitely a mold component as well. I was reading a fascinating book by Dr. Neil Nathan talking about mold, and he was just saying a lot of my clients are exactly like that with supplements and how sensitive they are, and you're not alone. And I was like, oh, thank goodness that's not just me. But then the benefit is that you really notice the difference with supplements and how they're working.
Yeah.
So
Well, we did a clinical trial on the product, and we actually used a big range of people. So often in clinical trials, which, as I mentioned, aren't usually done on supplements, so it's quite unusual that we have done one. We used people, male and female, aged 20 to 80, which is a huge range, to really get a good variation in lots of different people, lots of different life stages, to be able to see what the effect was across a whole host of different people. And we found that we didn't have any adverse effects in that study. And we found that across everyone, it was increasing NAD, it was activating the enzyme. And we also measured biological age and found that it actually reversed biological age. This was using the glycan age test by 1.26 years in 28 days of taking the supplement.
That's great. Okay, well, I'm definitely in now, but I want a 15-year drop like you. Now, Nichola, I've got to go in a sec because I've only got 1 minute 56 left on this Zoom call. So what is one book that you'd recommend that you've been reading recently, or that you like, or you'd recommend, and one tip for living with more energy and vitality?
So my go-to book is always Lifespan by David Sinclair. I just think it's a great overview of the aging space. It makes people completely think about it differently. I always tell everyone to read it. So that would be my go-to book. And in terms of energy, I would say my go-to thing is just getting out really early in the morning and getting some natural sunlight. Like if you follow me on Instagram, you will see I am like the early bird, always out. First thing in the morning, getting the fresh air, getting the sunlight. You don't get much sun in Newcastle, but I take what I get. And it seems to work. So,
you are a very early bird as well. Yeah. Look, it's great to talk to you. Where can people find out more about everything you've spoken about today and about Nuchido?
About Nuchido, go to our website, which is Nuchido, nuchido.com. And for me, I'm usually on Instagram at Dr. Nichola Conlon.
Yeah, with disgustingly early starts. Nichola, lovely to talk to you.
You too, Tony. Thank you so much.
That is it. Thank you to Nichola. And yeah, if you do go to the Nuchido site and you use the code Zestology, you can get 10% off Nicola's product and 10% off aging slower and living longer and healthier. So that sounds pretty good to me. Use the code Zestology for that. And thank you for listening to this podcast. Next week, as I say, I might be back with a personal update. I'm in the spare room in my house at the moment, surrounded by boxes. So I need to explain a little bit more about what's going on and where we're at. I'll look forward to doing that. In the meantime, have a super week. I want to say a big thank you to my podcast partner, Well Easy. Go to welleasy.co.uk for up to 20% off so many groceries. It's amazing how much you save. Sometimes it definitely feels like more than 20% as well. But the average Well Easy customer saves £250 a year. And it's all the sort of stuff you're going to buy in Whole Foods or Planet Organic. I mean, it's expensive, good quality, organic food, drink, supplements, household products, lifestyle products, the sort of things that you spend a lot of money on, and even just saving 20% on one item is a really good idea. It also gets delivered to your door. We had a Well Easy delivery a few days ago with Exhale coffee in it, with clean, lean protein in it, with some Hunter and Gather products in there as well. And if you use the code, it's a new code today, it's Zestology 2023. So Zestology 2023, then you will get £10 off your first order. So Zestology 2023, give it a go and see what happens. Love Well Easy. And I just read an article in The Guardian today that said that food prices are up 30% in a year. And I certainly feel like that. It's absolutely outrageous how much food costs. And I just worry for people. I just don't know how you can... I don't know how you can fill your fridge when it's that expensive. You know, for a lot of people, it's just really hard. And then, of course, eating organic is such a massive luxury now. And I mean, certainly the cost between an organic lettuce, which is like £2, and a non-organic one, which is like 80p, when you go to the shop. And I was comparing it this weekend. It just means that it's, for some people, it's too much of a luxury. And yet we know that when you eat organic, it's great for your health. So that is slightly depressing. A good way to mitigate some of those costs is go to welleasy.co.uk and use the code Zestology 2023. That's it. I'll speak to you next week. Thanks for listening to Zestology.